When you're working in the emergency department, there are some days where it seems like an unending number of patients that are in the waiting room. Everybody in the emergency department are sick, and you know you've got an abdominal pain or a chest pain or something that's sitting out in the waiting room, and you know you're trying to get to that patient.
We had just integrated with the University of Missouri, and with that we had access to a lot more data than what we were previously getting. The national benchmark for left without being seen was 2%. Looking at the data that we had, we were at 9%, which is well above where we needed to be.
Most of the reason that people leave without being seen is because the wait time to get seen in the emergency department is too long. That is a multifaceted problem, and it has to deal with what's the overall volume for the day. How quickly can we move people in and out of the emergency department? How sick are they? So when you're having trouble moving people out of the emergency department, whether it's to either get them home, get them to another procedure, or get them admitted, all of those things together with staffing of the physicians, staffing of the nurses, all of that funnels back out into the waiting room where you have longer wait times.
With social media, we would get comments from people in the community about their inability to get the care here that they needed. So reestablishing that trust to get them to where they knew that, hey, if we come here, we're gonna get the treatment we need, we're gonna have a great experience, was really important to us. It was a multidisciplinary approach. Our leadership teams were involved, our inpatient teams were involved, social work was involved, our physicians were involved.
EVS or housekeeping, you know, if they've got a bunch of rooms to clean all at one time and they're short-staffed as well, then all of that feeds into the length of time it takes to turn a room over. You know, so we had all of those different people in one room. You know, you make a list of problems, you start working through the list one at a time.
One of the big areas of opportunity that we identified as a way to improve our left without being seen rate is that we had some unused real estate in our department. It was a vacant waiting room, but it was not really being utilized. So we were able to take that space and turn it into 3 additional care spaces.
We knew that these changes that we were implementing were ultimately going to be beneficial to our patients. Increasing our throughput would open up more beds in the ED, which would allow quicker access to health care.
We started noticing little things like, hey, the waiting room's not quite so full quite so often, and it's not taking as long to get patients upstairs or out. We've gone from, I think it was 9% was the highest number we had, down to under 2. The whole process just seems to work more smoothly.
We are honored to have received the AIM for Excellence Award.
We love this community. We want to be able to provide the best care possible.
Trying to tackle something like this that's got as many moving parts as it does was a tremendous challenge, and I think that it just speaks to the cooperation between all the different parts of the hospital.
The one thing I would want people to know is that when everybody is on the same page together in the organization about something that you're wanting to achieve, it can be accomplished.